Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Dr. Vincent Pedre, who is the medical director of Pedre Integrative Health and founder of Dr. Pedre Wellness, nutraceutical consultant for Nature MD and orthomolecular products, CEO of Happy Gut Life, and a functional medicine certified practitioner in private practice in New York City since 2004. He believes the gut is the gateway to excellent wellness. As the best-selling author of Happy Gut, the cleansing program to help you lose weight, gain energy, and eliminate pain, featuring his proprietary blueprint for healing the Gut Care program, he has helped thousands around the world resolve their gut-related health issues. So welcome to the show, Dr. Pedre.
Thank you for having me. I'm excited.
Well, we both must love blueprints because in my book back here, Your Longevity Blueprint, I'm comparing the foundation of the home to the gastrointestinal system in the body. So I'm sure you agree that our gut really is our foundation of health.
Absolutely. I've used many different terms, the root system. I've called it the cornerstone of our health.
Yes.
The gut is central and critical to so many things. And especially if we're thinking about longevity and brain health, the gut-brain connection is just so important.
And I want to dive into that and talk more about that today. But first, kind of tell me what got you so interested in the gut microbiome and just gut health in general as it relates to promoting health and wellness. So where does your story begin?
Oh, geez. My story actually begins as a child that had a lot of gut issues, upset stomach, constipation, and then I was basically subjected to like round after round of antibiotics from around the age of 10 all the way through the end of my teenage years. I calculated that I was on 20 plus rounds of antibiotics during that decade.
Wow.
And as a result, I developed leaky gut. And because of a leaky gut, I then became sensitive to the top two biggest food groups in my diet, wheat, gluten, and dairy. And little did I know that I was, poisoning myself all through my 20s, not realizing that the foods that I was eating were weakening my immune system, making me feel sick to my gut, having, IBS, irritable bowel syndrome, but not really understanding that it was connected to my diet.
Right.
I often thought that it was related to stress, to my nerves. And yeah, that's one part of the picture, but there was this whole other part of the picture that I wasn't fully getting, and I didn't quite get until I started learning about the gut microbiome and leaky gut and understanding why gluten might be bad for me. And that was a really huge decision in 2007, actually, when I decided to go gluten-free.
Long time ago, yeah.
Long time ago, but it changed my life, gluten-free and dairy-free. And actually I'm still I'm mostly gluten-free, like 99.9%. And dairy, I only have seasonally over the summer months. And then the rest of the year, I won't have dairy because it weakens my immune system. And then I'm just more susceptible to viruses and colds. So a lot of what I do is to keep my health optimized. And I think just being intuitive about it. But it was really, if I think of that, I was basically patient zero with my gut issues. And through me seeing from my own experience, what a powerful transformation can happen by changing the diet, by incorporating, eating organic, making, being really keen about how food is sourced, and then starting to incorporate probiotics, fermented foods, varying the diet, and seeing that gut healing can happen, and that what I thought was a life sentence of irritable bowel was actually something that I could resolve. I started working with patients on it. And it was just me kind of like, almost like a hobby. Like, I just thought it was fun. And whenever a patient came in with gut health issues, which up until that point, as a trained doctor, we only had a few magic tools to take out of our doctor bag. And then I go into functional medicine, and there's all these different things. You might have yeast overgrowth, you might have SIBO, you might have an underlying parasite. We can do all this testing, can figure out what foods you might be sensitive to. And suddenly I have this giant toolkit of things that I could do with people. So I thought, this is a lot of fun. And my patients would get better, and they would send a family member or friend because they had gotten better. And so they recommend. And so before I knew it, I had become an accidental gut expert. I wasn't really planning on this, but it's kind of the way my life went. And I realized this is my passion. This is what I really want to dedicate myself to. And that finally led to me writing my book, Happy Gut. And that's kind of opened up the door, created the tidal wave that has brought me to so many places and done so many interviews, like your podcast, and been on TV and done a lot of great things.
So I have not read your book, but is there a happy ending there? Like, were you able to tell the audience, were you able to heal your gut after, a decade of insult from antibiotics and whatnot?
Absolutely. Yeah. And it's an ongoing project,
Yep.
so there's the recognizing that if I go out to a restaurant and say it's holidays and I decide I'm going to cheat or just be a little more lax on my diet, I know that I might pay for it in a sense. So I might not feel well for the next day. But what I can tell you is I recover like that. I can recover really fast. And that's what we see when you start healing the gut. You may not, like for me, I can't eat gluten. Like I have an immune reaction to gluten.
Me too.
I
Yeah.
just can never,
Yeah.
I can never bring it back. Can I cheat at a holiday party and have a little bit if there's something really good? Yeah, I could. And sometimes I might make that decision, and then I know I'm going to have to deal with the consequence. But what I've seen, even working with patients, is that the more you heal, the less it takes to recover from
Sure.
little indiscretions in the diet, whereas before, an indiscretion in the diet could mean 2 weeks of misery.
Yep. Get glutened. And yeah. Do you use, I know we're kind of going off on a tangent here, but do you use, obviously you're what did I read in your bio? Consultant for orthomolecular products. They have a new amazing product, the DG Protect,
Yes.
an
Oh,
enzyme to help
yes.
break down gluten and dairy, which I do like. What's your opinion on that? Do you feel like that's very helpful in times that you do intentionally cheat, or sometimes it's accidental? It's not even intentional, but
Yeah, sometimes it can be accidental. You go to a restaurant and they tell you everything's gluten-free, dairy-free, but the waiter sometimes doesn't know, or they're just telling you what you want to hear so that you're happy and they can get you off their plate. Well, I just did a presentation for Orthomolecular on the ingredients in DG Protect, the gluteolytic and dairylytic. And the evidence is really compelling at the ability of gluteolytic to break down gluten peptides within 90 minutes. Almost 100% of it is broken down. And it's because of the quality of the peptide in that, which is kind of, you could think of it as the new generation of DPP4, but it's an endopeptidase and an exopeptidase. And what that means is if a protein, say I'm taking this from my sounding bowl. This is my, I've got my sound bowl sitting here next to me. But let's say this is a protein. It's not folded right now. But endopeptidase are going to cut proteins in the middle, and exopeptidases are going to cut them at the end. When you bring in both enzymes, then they chop it up really well, and they can break down a protein really efficiently. And what this product does is it outperforms DPP4. So the gluteolytic is way faster and has a much stronger ability at breaking down those proteins, like gluten in wheat, which is very difficult to break down by our own digestive system.
Sure.
So if you're going to go out and you're going to cheat, or you're just going to have a good time, then that's the time to pop in that extra enzyme support and at least reduce the likelihood, because the more it's broken down into its component amino acids, the less likely it's going to cause any sort of immunological reaction.
Yep.
Right? And it's not going to damage the gut lining as much.
So for those listeners, we're not saying you can eat gluten. We're saying if on occasion, like the holidays, you accidentally or you intentionally choose to consume some, this can really lessen that burden on your body. So I know we went off on a tangent, but
I have my patients who like to eat out, and
when they eat out, exactly.
Yeah, when you eat out and you don't want to be stressed, like you might tell the restaurant you're gluten-free, dairy-free, or you might be embarrassed to say it. I mean, I don't know. I'm always like, yeah, I'm one of those. What's
Oh, I own
gluten-free?
it.
What's
I own
dairy-free
it.
on your menu? You can imagine when I go out with my science doctor friends, like it's like, okay, we've got gluten-free, dairy-free, soy-free. We
Vegan.
can't
Oh,
have any omega-6 oils.
we should be eating. Okay. Let me
So
come
what do
back.
you
Sir,
fry your food with? Do you use avocado oil or do
I
you
do
use?
use, yeah, no, me personally, yes. Uh, so let's come back. I want to talk about the gut aging connection since this is more of a longevity podcast. But you opened when you were telling us your story a little bit of how you developed leaky gut. And we've talked a little bit about that on the podcast, but can you differentiate? This is a more difficult question, but can you differentiate leaky gut symptoms versus kind of SIBO and even yeast overgrowth? So that's kind of a
Okay.
triad I see a lot. And sometimes patients have all of those, but can you kind of differentiate, quickly to the audience what those are? As you kind of mentioned, those were problems you were finding in your patients as you kind of became that specialty doctor.
Yeah, absolutely. So SIBO is small intestinal bacterial overgrowth. And what that means is that there is a higher concentration of bacteria present in the small intestine where they're not supposed to be present. And it could be an overgrowth of bacteria that normally live in the small intestine, like lactobacillus, or it could be bacteria that have migrated from the bigger reservoir of the gut microbiome, the large intestine, into the small intestine through the ileocecal valve. And it doesn't matter which type it is, it's going to cause the same types of symptoms. Candida or fungal overgrowth is just basically an excess of yeast in the gut. The confusing thing is that you can have SIBO, you can have SIFO, so small intestinal fungal overgrowth, or Candida, as people know it. You can have both of them at the same time. And both of these can lead to leaky gut. So now you can have a triple whammy. You've got SIBO, SIFO, and you've got leaky gut. So small intestinal fungal overgrowth for SIFO. So I almost, one time I wrote a post about this and I said, maybe we need to stop talking about SIBO and SIFO and just start talking about SIMO, which is small intestine microbial overgrowth. And
Okay.
microbial could be bacterial, it could be yeast, or it could be both. And I think if we think about it that way, then I think it becomes easier to not miss something with a patient.
Sure.
Because I think oftentimes if you think, oh, you just have SIBO and you're not thinking about SIFO or Candida, but you haven't really ruled it out. You haven't ruled it in, you haven't ruled it out, but you're overlooking it. And then your patient is getting better from SIBO and then suddenly they start having symptoms again. Well, is there SIBO coming back or is there something you missed?
Yeah, you raise a good point because for the listeners, the conventional approach, if your conventional doc even tests you for SIBO, but the conventional treatment approach is an antibiotic, which antibiotics would not treat a SIFO, right? They could potentially feed the yeast.
They can actually, antibiotics, what they do is they come in and they shift the ecology. So they allow another predator to come in that's not affected by the antibiotic. In this case, they can allow yeast overgrowth by decimating the presence of good bacteria as well. So what I've seen over the years, a lot of times, is someone has SIBO, they see a conventional doctor, they get an antibiotic, they feel better for anywhere between 1 and 3 months, and then they start feeling worse again. Similar symptoms, so SIBO and SIFO, Candida, they can masquerade, they can look the same, but they're different underlying causes. And the question there is, do they have repeat SIBO or do they now have Candida, which was triggered by being put on antibiotics? Yep. And the fact that they started, their foundation wasn't good. The reason that they developed, that you have to go backwards in pathophysiology, like, well, why did this person develop SIBO in the first place?
Sure.
Or do they have low stomach acid, which is something that that increases with age. So the older you are, the more likely you are to have lower stomach acid. With lower stomach acid, you're not as protected from bacteria and yeast that come naturally, are found on food, that come through the food. So that puts you at a higher risk for developing a bacterial overgrowth or a fungal overgrowth in the small intestine. So you really have to think about all those things, because what we do in functional medicine is we look for the root cause of the condition. We don't just stop by treating the condition. We're looking at what was the underlying process in the first place that caused this person to develop these symptoms. And when we started by talking about, the connection between SIBO, SIFO, and leaky gut. And also, I think very important to note for people is that leaky gut is like the portal to many other chronic conditions in the body.
Yes, that was my next question for you.
It's connected to everything. So to the lungs, to asthma, to allergies, to migraines, to brain health issues, mental fog.
Endometriosis, even reproductive issues. Yeah. So
all of that, hormonal balance, autoimmunity, all of these things can have a common factor in leaky gut.
So how and kind of why? So as functional medicine practitioners, we know this, but can you share with the audience? So what is that connection? So how does leaky gut contribute to asthma or endometriosis or eczema or whatnot?
Leaky gut is almost like downstream process from what caused it. So usually leaky gut is happening in the setting of antibiotics, of a poor diet, of excess alcohol intake, high stress, exposure to over-the-counter medicines like ibuprofen. And even, I found this interesting because a study showed that acetaminophen can cause dysbiosis, imbalance between good and bad bugs, and that leads to leaky gut. So we used to just say that NSAIDs lead to leaky gut, but now we know that even acetaminophen, which is not an NSAID, can also lead to leaky gut. Birth control pill leads to leaky gut. And leaky gut then allows for more inflammation to becoming, inflammatory factors to be coming in through that gut interface. That can be endotoxin. It can be actually bacteria. Bacterial DNA has been found in the bloodstream of people, especially the leakier the gut. And that turns on an inflammatory cascade that is going to be expressed in different ways by different people. So one person, maybe their Achilles heel is their brain, so they're going to have more brain symptoms. Another person, their Achilles heel is the lungs, so they're going to have a lot of lung symptoms related to that. And or they might have allergies. It's amazing what happens when you clean out the diet, you fix the gut, then other issues just start to improve. That a lot of times you just don't expect. Like people will be surprised, like I fixed my diet, my gut is better, but now my sinuses aren't inflamed like they used to be.
It is amazing. It is amazing. And I think that's what's very rewarding about what we do is many times without drugs, we just see a tremendous healing process, and the patients get to see the power of what their body can do. It really can heal itself.
Yeah.
Oh, thank you for explaining that. So let's come back to this concept of inflammaging. You kind of just talked about that as far as how inflammation can manifest in different organ systems, but how does that tie into aging?
Very important because that endotoxin, so when you have leaky gut, and endotoxin, also known as LPS or lipopolysaccharide, which has an incredible ability to get through membranes. So it can get through the blood-brain barrier, which is a protective barrier that creates a protected circulation for the brain. Well, that LPS can get through there, and there are receptors for LPS in the hypothalamus. They're called toll-like receptors. And when that receptor gets activated, it turns on a whole cascade. It's kind of like a domino effect. So just imagine once that receptor gets activated, it sets off this whole domino effect inside the cell that turns on the expression of NF-kappa B, which then turns on a whole bunch of inflammatory genes. Well, what is an inflamed brain, an inflamed hypothalamus? It's depressed, maybe anxious. It's having mental fog. It's having memory issues because memory starts in the hypothalamus. And so, and these are kind of like we talk about these things, and these are kind of like the things we associate with aging, like not remembering things, forgetting where you put your keys, having word recall difficulties, not remembering what the thought that you just had, it just escaped you. These are all signs that can happen from a shrinking hypothalamus that can be related to leaky gut, amongst other things. The other connection, if we want to tie it back into the brain and the gut-brain connection, is the HPA axis. And when people are highly stressed, they're in fight or flight, which is very common these days. Their cortisol levels are high, and that causes a disturbance in the gut microbiome. So you get more unfavorable bugs. That increases the permeability of the gut. And high cortisol in the brain causes the hypothalamus to shrink. And that leads to memory issues.
Yeah. Did you hear that, listeners? Say that again. High cortisol causes the hypothalamus to shrink?
Yeah.
Yikes.
And just think, if you have high cortisol, you're in fight or flight, that means that you're in this catecholamine surge. And what I teach people is that catecholamines are like an attack on the gut. And they basically increase the permeability of the gut lining. So it becomes this cascade of events. And once you've got, shrinking of the hypothalamus, it's going to take a lot of work to rebuild that. You've got to work on the diet. You've got to work on gut health. You've got to work on a lot of things to help to start to rebuild memory and brain health.
Sure. Well, tell me, is there a microbiome of aging?
That's a really great question. And there have been studies done on how the microbiome evolves as we age. And there's definitely differences in the makeup of the microbiome. And one of the factors that they think is responsible for aging is that as people age, the microbiome starts to shift, and there may be more bacteria in the microbiome that support inflammation than bacteria that support anti-inflammation. And I ran into a study that was really interesting. It was done looking at centenarians. So kind of going backwards and thinking, centenarians seem to have this decreased susceptibility to illnesses.
Everything.
What's that?
It's like to everything.
Yeah, like to chronic inflammation, to infectious diseases. And they asked the question, is there something about the gut microbiota that gives centenarians this greater resistance?
Yeah.
More resistance to infection, to environmental stressors. And in this one study, they looked at centenarians, and they actually discovered a new secondary bile metabolite that was called isoallolithocholic acid. And for anyone who doesn't know what bile metabolites are, so your liver produces bile, and bile's part of what helps us emulsify the fats in the foods that we eat, so we can absorb the fats, we can absorb fat-soluble vitamins. And bile is also an antimicrobial. People might not realize this, but sometimes people who have small intestinal bacterial overgrowth actually just have bile acid deficiency. They're not producing enough bile, or maybe they've had their gallbladder out, so they're more susceptible. Well, there are bacteria in the gut that take those primary bile acids, and they metabolize them into these secondary bile acids, and they play important roles both in the body and in the gut. And what they found was that these centenarians were producing a secondary bile acid that was, and it's a series of them. So there's a couple of different iso, 3-oxo, allo. isoallolithocolic acid. And what this secondary bile acid metabolite seemed to be able to do is it had antimicrobial properties against gram-positive multi-drug resistant pathogens, including C. diff and Enterococcus faecium, which are two inflammatory types of bacteria that might live inside a person's gut, inside the microbiome.
Sure.
And they also had strains of a type of bacteria called Autoribacteraceae, which, don't you love these names?
You pronounced it well. I wouldn't have been able to pronounce it.
I was like, how did I do that? They're able to take the bile acid and metabolize it into this secondary bile acid metabolite that seems to have some benefit in reducing their risk of infection and maintaining a healthy gut environment. So how, and I think it's such a great thing to ask, like, look at centenarians and ask, what is different about their gut microbiome?
Right.
Why have they lived this many years? Why them and others not so much?
Yeah. Get a fecal transplant from a centenarian. Just kidding. So what did we take from that study though? So do you think that, and maybe I'm pulling at strings here, but do you think more individuals should be taking bile as they age? I mean, would that be
It's a good
helpful to help
question.
regulate pathogenic load? And is that maybe a take home from that?
I think it's a good question. I think for anyone who, especially if they do a stool analysis and they find that there's fat malabsorption in the stool analysis,
Yep.
They should be taking some form of comprehensive enzyme that has
Mhm.
bile in it. A lot of these people also need to look at their ability to break down protein, and they might need to be taking betaine HCl to augment stomach acid in order to be able to break down their protein. And a lot of times you'll find comprehensive enzymes that have both the betaine HCl, they have the
Yep.
proteases, and they've got the ox bile to help the person, comprehensively break down protein and absorb fat in a way that's going to be friendlier to the body.
Yep.
So I think, I think this is really important. And what a lot of people don't realize, and I've seen over the years, is as my patients get older, they'll tell me, "Oh, I don't, I'm eating less meat now because I just don't digest it well."
I hear that too. Yeah.
And it might not be the best thing for them because they still need protein in healthy amounts in order to maintain lean body mass.
Yep.
And they might not even be breaking down the plant proteins properly, because if they're starting to eat less meat because they don't digest it properly, that's a sign of low stomach acid.
Yep. And that's also something we can find on the stool test that you were alluding to. Like we can check to see if literally patients are pooping out their fats. We can also look to see if they're pooping out their protein, suggested that they need some hydrochloric
Absolutely.
acid to help with digestion there too. So a really comprehensive stool test from a functional medicine practitioner can help you really determine what your needs are that we've been talking about. So do you feel like it's important to live in multi-generational households? And why is that important? What does that have to do with our microbiome? Is there a relationship there?
That's a great question. So I went to the Microbiome Congress pre-pandemic, so I think it was 2019, and listened to a presenter from McGill University, I believe, in Canada, who was doing studies of multi-generational microbiomes. And what they found was that, because we also, in these multi-generational households, is where we find a lot of centenarians. And what she was finding is that older people who lived in multi-generational households had a younger fingerprint of their microbiome than ones that didn't. And the theory was that there was some sharing of microbiome that was happening by being in a house with little kids, with teenagers, with other people that were younger, that they were actually, kind of like cross-pollinating their microbiomes and keeping their own microbiome younger than what it would be if you were just living separately and aging. So I think it's something to explore. And even I know now, like people are exploring these conscious living communities. So kind of like the next iteration of a retirement community, but instead of just being for old people, actually being a multi-generational conscious living community where there are kids or people of all ages. And maybe that's a better way to look at the way we should be aging, not like saying, okay, you're old, now go live with other old people only and be separate from all the younger people.
There are, so many strengths, and I think mixing the different age demographics. I love that. I love hearing that. So again, back to just how this is a longevity podcast. What impact do you think intermittent fasting has on longevity and kind of gut health? Is there a relationship there?
First of all, when you fast, one thing that you're doing is you're giving your gut a rest. And during that rest, your gut has a chance, when it's not digesting, it's repairing. And while you're fasting, your gut can turn on all the repair processes. And depending on, women or male, probably the healthier across the board fast is a 12-hour overnight fast. That's okay for everyone. When you start getting into longer fasts, they tend to not be as good for women than men. You don't want to, the thing to know about fasting and aging is, look, you reduce your inflammation, you're reducing endotoxemia, you're allowing repair of those tight junctions in the gut. So you're allowing the permeability of the gut to reset. So it does a lot of these really great things. What you don't want to do when you're fasting is get your body into a stress mode because maybe you're eating too little. So you can take fasting to extreme, and then you're not eating enough, and then your body is starting to feel stressed. You start becoming biophysically stressed, which means then we go back to the high cortisol, the catecholamines, and the leaky gut, and the effects on the brain. So there's a balance there. But I do find that a lot of my patients, especially as my patients get older, they enjoy fasting, and they find that they think more clearly when they're fasting. And the brain runs better on ketones than it does on sugar. So even just considering the type of diet that one is adhering to as we get older, I often joke with my patients that the body is like playing a board game that changes the rules on you as you get older, but doesn't tell you what the rules have changed to. You have to figure it out by playing the game. Now, sometimes playing the game means that you're playing it with the old rules from when you were 20, in your 20s and 30s, and then you start gaining weight and you don't understand why. Well, you're eating too many refined carbs, you're eating too much sugar. And whereas before you could cut it out for a week and you would start losing weight, now your body doesn't do that.
The rules changed on you. Yeah.
The rules changed. The board game rules changed, and you've got to be savvy and keep up with the rule changes if you want to stay healthy into your later years.
I love that. I've never heard that. That's great. That explains a lot. That's got to figure out those rules. Okay. I know you're also very passionate about the gut-brain connection. So you've alluded to this a little bit already today, but how can improving our gut health really improve mental health?
Yeah, the first thing to really think about there is the vagus nerve and the connection, one of the cranial nerves, and its connection between the brain and the brainstem and the gut, because it's controlling a lot of what's going on in the brain. And I call it the telephone wire between the gut and the brain that allows the gut and the brain to speak to each other. The thing is, there are more wires, I think 80%, pointing up to the brain from the gut than from the brain down to the gut. So there's actually more feedback going to the brain. And it turns out that our little gut bugs are producing neurotransmitters like serotonin. And the vagus nerve has 5-HT receptors at its nerve endings in the gut. So when those little gut bacteria produce serotonin, they bind to the 5-HT receptor at the end of that, of the afferent neuron for the vagus nerve, and sends an impulse to the brain. And those impulses can do different things. And one of the things that are one of the neurotransmitters that's secreted through a vagal impulse is GABA, which is gamma aminobutyric acid, an inhibitory neurotransmitter that kind of calms things down. But it's that vagus nerve is really key to the health of both the brain as well as the gut. And what happens with people with mental health issues like depression and anxiety is they lose vagal tone. And a lot of times, so imagine vagal tone as the dial tone on your telephone in the olden days when you remember that. I don't think anybody has these anymore, but when you used to pick up the phone and it had a dial tone.
Yeah, one right here.
Yeah. And the dial tone basically was there to let you know that the phone is working, that it's not dead. And remember when you pick up the dial tone and you don't hear anything, and then you're like pressing, like, where's the dial tone? Well, same thing. There's a dial tone between your brain and your gut, and it's going through the vagus nerve. And when you lose that dial tone, that vagal tone, then you develop leaky gut. You don't produce enough digestive enzymes. But in the opposite direction, you start seeing depression, you start seeing anxiety. And there's actually been studies done with treatment-resistant depression where they used a vagal nerve stimulation device, an electric stim device, and found that people who they've had exhausted all remedies, they had tried all types of treatments, medications to reverse the depression, that using a vagal nerve stimulation device was actually able to reverse, I think, up to 30% of people with major depressive disorder.
Wow.
And I think that's remarkable. Like, wow, like something without medication can actually, and all you did was stimulate the vagus nerve here in the neck because it runs down the neck and into the GI tract. So it just highlights the importance of maintaining that vagal tone as one of the keys to healthy aging. And there are a lot of fun things that we can do to maintain vagal tone, from deep diaphragmatic breathing to sighing, like big, deep sighs of relief, and saying, like really producing a vibration here in the vocal cords, or humming along to your favorite song, or singing in the shower,
Gargling.
or gargling. There's so many ways that we can activate and stimulate that vagus nerve to keep that underlying tone active, which is both important for gut health but also mental health. So that's something I think that a lot of people don't know and aren't aware about, is that telephone wire between their gut and their brain, and how important it is to maintain the channel of communication between the two.
Sure. I love that. I'm putting you on the spot here, but in a recent Speak Off, well, I guess that you would call it a Speak Off event that you were in for our health entrepreneur group, you said something in your presentation that I want to come back to. I think you said something about taking 1 round of antibiotics per year increase the risk of depression a certain percentage. Do you know what I'm alluding to that you said in that presentation?
I think what I said is that I think the statistics that I had said was that in the last month alone, 44 million Americans had taken an antidepressant. And 1 in 5, I think now it's 2 in 5 adults report having a mental health issue.
Wow.
So it's something that's really big, it's present.
Yeah.
And thank you for bringing that up, because another thing that I talked about in that presentation was, maybe the next generation of treatments for mental health is actually in the gut, using a type of probiotic known as a psychobiotic, or bacteria that have beneficial effects on brain health because of the secondary metabolites that they produce. Maybe they're producing butyrate, or they help lower anxiety in the brain. They might produce GABA. And there's certain types of probiotic bacteria that have been shown to do this in studies. Like one, for example, is Lactobacillus plantarum DR7. So DR7 is the particular strain. So it goes from genus, species to strain. And these probiotic bacteria are very specific. Different strains do different things. And this one in studies was shown to reduce anxiety in the participants. So really fascinating, because I think it starts to open up the question of how we're approaching mental health by treating the symptom using SSRIs, serotonin reuptake inhibitors that increase serotonin at the synapse,
Yep.
versus thinking about, well, how can we improve the gut-brain connection so that then maybe the depression can start lifting. And we know that some of these bacteria, because of what they produce, they also help stimulate the vagus nerve. So they play a role in that vagal tone that is so important for mental health.
Love it, love it, love it. Okay, I want to come back to just some easy take homes for the listeners. So you've already mentioned kind of what contributes to poor gut health as far as what poor vagal tone, taking antibiotics, right? Eating crappy foods. What are some things the listeners can do now to improve if they don't have a functional medicine practitioner, although I recommend they find one, they don't have access to fancy testing? What are some easy things they could do today to help start improving their gut health?
Absolutely. Look, number one is work on your stress. If all you do is just learn to breathe better, like, you're going to improve your gut health, you're going to improve your internal state of being, you're going to improve your ability to focus, to be present, to take in the world around you. So I think that is number one, because it covers so many bases. Like, even just learning how to do deep diaphragmatic breath work, or even box breathing, which is a breathing technique that was developed by the Navy SEALs to deal with stressful situations. And then secondly, meditation, because it's so important. I tell people that breath work is the portal to meditation. So it's the pathway, because you can't, like, if you're stressed and your mind is all over the place, how can you sit down and then just start meditating?
You
No,
can.
you sit down or you walk, you start with breath work. And then once you feel that internal shift, then you can sit down and meditate and shift your mind. And we know that when you meditate, it shifts the circulation patterns in the brain, and it activates the lymphatics. It does so many things that are good for brain health, but it's also going to calm the body. And it's so important to be in the parasympathetic state of rest and digest in order to have a healthier digestion. Just think of when you've been stressed about something and you've got like a knot in your throat, or you've got a knot in your stomach, and you lose your appetite. Like, I think everybody can relate to that. And if you can, then you see there is such a powerful connection between the brain and the gut. And the body does as the brain thinks, and the brain does as the body feels. So it's a bidirectional thing. We can influence our gut by the way that the thoughts that we are holding, what we're experiencing in our body. So creating a feeling of safety through breath work and meditation, I think, is really important. The other thing that we learned this year from a study done at Stanford University is that if you want to increase microbial diversity in the gut, and for anybody listening, microbial diversity is like the holy grail. If you've got microbial diversity, it's a beautiful ecosystem. There's a lot of different players in there, and they help keep things in balance, and they reduce inflammation in your body, which is the common factor in aging and in chronic disease. And what they found in this study was that there were two things that were actually improved by a diet that was high in fermented foods. One was microbial diversity, and two, it lowered 19 different inflammatory markers.
Wow.
And that was a diet high in fermented foods. Now, if you haven't been eating fermented foods, don't go out and buy a vat of sauerkraut and then just start like going crazy with sauerkraut. Don't do what Americans do. That is like, if a little's good, a lot is going to even be better. If you haven't eaten fermented foods, you've got to introduce them very slowly. You start with a teaspoon, then a tablespoon, you experiment, you see how it sits with you. Because incorporating ferments can cause die-off of bad things in the gut, and that die-off can make you feel kind of crappy inside. So don't do it all at once. Now, if you want to eat in a way that modulates your immune response and improves gut health at the same time, you've got to increase your fiber intake. So if we're looking at two ways that we can improve gut health, increase the amount of fermented foods, increase your dark leafy greens, increase your vegetables, incorporate some garlic, some onions into your cooking that have nice prebiotics. Dandelion greens, also rich in prebiotics, some of the bitters. All these things are really good for gut health. I'm also a big fan of broths, whether vegetable broth or bone broth, for healing the gut. And in terms of nutrients, one of the best nutrients that can basically tip the scales of healing in the gut is L-glutamine, which is one of the most abundant amino acids in the body. But when taken as a powder, or you can also take it as capsules, it's just easier to take it as a powder. It helps the cells that line the small intestine heal their permeability. So it helps seal up those tight junctions and reverse leaky gut. So it can be a game changer for people to incorporate L-glutamine as part of the gut healing protocol.
All fabulous tips. Like everything you say makes me want to ask you another question, and I promise we'll wrap this up here. But I want to ask about
one of my interviews always go long, like over time, because there's just so much to talk about.
There is. So when you were mentioning eating fermented foods, like introducing them too quickly, potential is that that could cause die-off. That made me think about serum-derived immunoglobulins. So is that something that you support? Are you for them? Can you just explain a little bit about why those are important for gut health and full body health, actually?
So any serum-derived immunoglobulins are coming from cows. And the great thing about them is they bypass the problem that we run into with colostrum or immunoglobulins derived from milk, because they can still have some of the milk solids in them. And for anybody who's dairy sensitive, that can be problematic. So you avoid that by using an SBI or serum-derived bovine immunoglobulin. The great thing about immunoglobulin is it's not going to be absorbed into your circulation. It actually stays in the gut. They're antibody molecules that look like goalposts, and they're designed to bind to antigens. What types of antigens might they encounter in your gut? Well, they might see endotoxin, for example, and bind to that endotoxin. And when they do that, the endotoxin now can't cross your gut barrier, your gut interface, and enter your body. They can also see a whole bunch of they bind to C. diff toxins A and B. They can also bind to CDTs, cytolethal descending toxins that come from E. coli, Salmonella, Campylobacter. So they can bind to a lot of different toxins that damage the gut lining and increase gut permeability and increase inflammation. So when you're working with a patient to heal their gut, SBIs can be really helpful if you're treating things like SIBO, yeast overgrowth, where you're expecting that there's going to be die-off. And in order to kind of dampen the die-off effect and protect the gut lining, you can add SBIs as part of the protocol. You might be treating them with spore-based probiotic. You might be using antimicrobial herbs. And you're expecting the person's going to have some level of die-off, especially if they're coming in with a lot of leaky gut-related symptoms, lots of mental fog, achiness, joint aches, body aches, fatigue. So you can give the patient SBIs, and that can help mitigate the issue and actually help basically augment the healing process, speed it up.
Yes, if we're getting rid of the pathogens or the toxins that are contributing to inflammation and leaky gut, essentially, we remove them, then yes, it's just going to expedite the healing process. With the diet changes, with supplements like glutamine, with stress reduction, right, all together for the best outcome. So tell us, this has
Absolutely.
been wonderful. So tell us, where can listeners connect with you, find you? I know you have a free gift as well, so please share.
Uh, People can find me on Instagram at Dr. Pedre, Facebook, Dr. Vincent Pedre. They can check out my website, happygutlife.com. They can also look at my, find out more about the types of consultations that I offer at pedremd.com. And we've got a really great gift for your audience that is actually our most popular free download. It's called the Top 10 Tips for a Healthy, Happy Gut. And it's basically kind of like a quick and dirty cliff notes to everything that I talk about in my book, Happy Gut. All the pearls that are the great takeaways and really great advice, but also with some recipes for people to be able to make. And yeah, we get really great feedback from that. So I'm happy to share it with your audience.
I want to see that. I look forward to checking that out. Thank you. So last question, what is your top longevity tip? If you had to pick one, what is your top?
Wow. I think
Or is that not fair to make you pick one?
No, I like this. I think one of my top longevity picks would be to carve out time every day to do something that doesn't involve a task, doesn't involve work, something that you just truly love. Because when you spend time doing something that you love, say you love to paint, or say you enjoy playing an instrument, or you enjoy writing in a journal, when you do something that you love and you expand on that feeling of love, what that then triggers in your brain is a release of oxytocin. And oxytocin is the antidote to cortisol, to high cortisol. It basically neutralizes cortisol and it helps calm the system. So it kind of ties back into the importance of stress management, but from approaching it from a fun place. Like, do something that you really love. I mean, it could be like walking on the beach at sunset. You know, if you really love that, that's one of my things. Like, I love doing that. That calms me. That brings me into a space of joy. If people can set aside time to do something like that every day and augment their feelings of joy and happiness, I think that's, for me, I think, you know, because it has so many other cascade effects in the body that are unmeasurable, but you can feel them. That is my one longevity tip for your audience.
Yeah, that's beautiful. I tell patients, do something that brings you joy, like every day, not once a quarter or once a month or once a week. Like you're saying, carve out time every single day. So I
love that. I love that question. Like, you know, what do you do that
what's one thing you do?
Yeah. What's a thing you do that you enjoy, that brings you happiness? And a lot of times they just sit there and just look at me
like I don't know. Yeah.
like,
That's a problem. We got to find something. Exactly.
I go to work, I come home. Yeah.
Got to find that. Yes, got to find that. Well, thank you so much today for coming on the show and really breaking down the gut, brain, aging, chronic disease connection. So this was excellent. Thank you so much.
Thanks for having me. Great conversation.